welcome back to another episode of Nails, Cocktails, and Convos with Mo. We got Queasy in the building with us one more time for the fun time.
Hey, y'all.
Y'all know me, I'm Mo. This is Keita Boo.
Hi.
We got Shalonda, she a newbie up in here. She ain't new to Post Mo, but she new for the podcast.
Hey.
And we got Key.
She always
Key is back. Yes.
Every week.
So tonight we're talking about women's health because too many of us have suffered from, suffered in silence from PCOS, endometriosis, fibroids, and perimenopause and menopause. If we're not suffering from it, then we know somebody else that's suffering from it. So we're going to discuss these things that is so important to us women and dealing with it along with other things that we deal with is a lot. Or we may be dealing with multiple health issues. Mm-hmm. We're going to discuss these things tonight. So, y'all ready to get started?
We ready.
Before we get started, yes, I made us a little cocktail.
They good.
Yes. Real good.
It is a kiwi colada made with fresh kiwi. Mm-hmm. So we sipping on that tonight.
It's really good.
Yes,
refreshing.
yes. We got us a shot after we get through talking about this because, we dealing with this issue. So we gonna take a shot at the end to help with this a little bit. So
You about to be done again, the first one again. Cheers. This is so good, y'all.
it's good. Mm-hmm. Well, I'm glad y'all like
You
it.
have to just sip it.
Yeah, that's what I'm doing.
So perimenopause, what is it?
It's horrible.
It's horrible.
It's a monster.
It is horrible.
Yeah, nobody told us about this shit.
No.
My mama told me about it. It just, I didn't know.
We knew about
What it
menopause.
was.
Like
Right.
it
I
really
never
was
heard of
like
it.
the
I didn't-
heaviness of it. Like
Yeah, the real
they
deal.
carried it so well that we did not know how difficult it was.
Yeah.
Mm-hmm.
Because this shit is difficult.
It is.
Yes.
From the hot flashes to the night sweats, mood swings, anxiety, brain fog, irregular periods, trouble sleeping, weight changes, low energy.
Oh.
Those are the common symptoms of
Yes.
some of the common symptoms. Yes, acne, depression,
Itchy ears. Y'all ears. Yes.
Yeah, my ears do
itch
itch.
like
Yeah.
crazy.
On the inside or on the
Yeah.
outside?
In the inside.
Oh,
Yes.
wow.
Yeah.
Yeah.
Shoulder be bothering me sometimes.
Yeah,
Frozen
your joint,
shoulder.
Yeah.
Girl, I
Yeah.
hate it. I had to go to physical therapy.
They some young babies, so they
I
ain't.
am a baby. I ain't never had a broken elbow.
But guess what? Keep living, cause
Okay.
a few more years, you gonna be itching like a motherfucker. Everywhere.
I'm be itching like Pookie.
Yeah.
And sometimes you do
your
itch
skin,
over
yes.
your body.
You be
Yes.
like, what is
Yes.
it?
Yes.
Really?
Yeah.
Y'all
but
take something for
that
that?
frozen shoulder ain't no joke.
I don't know
That's
what
I
that
had
is.
it before. I had frozen shoulder.
It's called frozen shoulder.
It helps 99%.
And I
For real.
couldn't lift my arm
Over a certain
Some
period.
like a
you
certain
don't
period.
feel-
My arm was hurting literally from my shoulder to my hand, and I had to do physical therapy for 3 months. I had to do it for 3 months.
You
because I
haven't
had
begun
frozen
to experience
shoulder.
none of this stuff?
Well, you
But I
know
have
what?
thyroid.
Well, they
I do
always
too, but
tell
I've
you.
never experienced none
You
of
go
this.
off your mom, your grandmother, aunt, siblings, siblings,
Right.
whatever age they started, because it's be kind of like a hereditary thing around the age. So everybody in my family started early. I started at 43.
So actually, it's this black
I'ma
doctor.
say it
I don't
again.
remember his name, but
Dr. Pierre Johnson.
yes, he's at Loretta. Yes, and he was
did
just
me.
saying like from
Yes.
the time we reach when young women become 18, I believe he said in that area it starts to decline. So you're gonna start having them issues.
Yep.
Soon as that happens,
18.
Yeah.
Yeah, he said,
all
but-
women or just black?
all women. But he
Because
said
that is the pre-menopause. So what we are experiencing now is the peri-menopause.
So he said it's just as long as you have a uterus, it's just you're gonna go through them all them symptoms.
Really?
That's what he said.
Yeah. Take my shit. Take my uterus.
Do it with a kid.
But
I
guess
don't want
what?
no penis now.
You can take all of that
And still
but-
have symptoms.
And still have symptoms,
Yeah.
especially if they don't take your ovaries.
Take
And you
them
don't
bitches too.
necessarily
Don't
want
they,
them
you
to
don't
take your
Don't they
ovaries.
set it off?
So if they
what
take your
happens if they take
ovaries,
your
they
ovaries?
will.
Will you
Go-
do that a
experience the
hysterectomy,
same
a full
thing?
It's a
hysterectomy?
full
They take
hysterectomy
everything?
is with your ovaries, everything.
Mm.
So I have a partial.
Okay.
So my ovaries are
A
still
partial
intact.
hysterectomy?
Yes.
Okay. Just so people can hear us.
Yes, exactly. But it's still like, so everything, all this perimenopause, I'm feeling it.
Okay.
And it's horrible. And I really wish that he just would have. But even when they take all of it together, you got to realize you're taking your ovaries, you're taking things that increase your hormones.
Yeah.
And regulate your hormones. So you're going to experience that either way.
Yeah.
Yeah.
It's just really our heart about, we don't have a lot of people that are supportive of us to help us through this journey.
Advocating.
Yep, to advocate for us.
It's a nightmare.
So what do you
Yes.
suggest
Nightmare.
with the help? What things do you try to use to help with your symptoms? And what do you think we need help in, or yourself needs help in, from doctors or a support group, a community of people that will help with dealing with this? Or is it a medication that they need to come out with to help control? Because they can medicate everything in this world, but why they ain't came out with something to help deal with these symptoms?
Well, they do have things to help us deal with these symptoms, but I think at the first and foremost, we need to. It's good, ain't it? We really need to take better care of our bodies, and we don't do that.
True.
We don't.
What's some
do
of the
that.
things that we can do to do better?
Walk daily.
Or
You need
prevent
to
them.
walk.
Or prevent it.
You need to walk. You need to be mindful of what you eat. You need to be mindful of your environment. All of that. But as I'm saying this, it's not easy to do that. You know, and we use other things to help medicate us. But I do first and foremost think that health and what we put into our bodies is what helps us. Next step, again, as I said, what we have in our environment, the stressors and all of that, that makes a huge difference.
Because them kids be a trigger to shit.
I was going to say they
Kids,
say
right?
stress is a trigger to things in our bodies.
Yes, it is. Most definitely. And I think after that, you know, you need to get with a medical profession who is, you know, professional in this, who
Specialize
can
in that area.
specialize in that area, can they help you work through your personal experience, because not all of us are experiencing the same symptoms, and we don't always have the same background and issues. Yes.
True. Because some
So-
people have some of the issues, but not all of them.
Yep.
Yeah, that's
I
true.
think I'm not some people because I experienced some of every symptom there is.
Right, you be feeling like,
It's horrible.
Yeah.
The
Yeah.
depression part, the stress part.
What if it's
The
just
weight
something
loss.
our bodies are lacking though that's causing all of that?
Exactly. It's
Yeah.
the minerals.
It could
And you
be,
know,
yeah.
it's the food that we
We eat
eat.
a lot of
Yeah.
processed stuff, so maybe going to Whole Foods. So like
See.
trying to train yourself to where you say, I'm gonna eat at home and eat more whole food 5 days out of the week. Give yourself 2 days to, like, you know,
Play out.
and see.
Yeah.
Right.
I do that. But it's like my doctor told me so many different things that are trigger. Like I go through hot flashes all day, every day. They come like every 20, 25 minutes.
You know the time.
Wow.
Yes,
But-
because it used to be, it didn't come like that fast. I used to get them like every so many hours. Now, maybe bad.
Do you
Maybe back
sweat in
to-
your sleep?
I get it.
Yes.
Sleep, if I'm at work, that's when I have it the most. I go through the most at work. I guess because I have more time at work. I'll be at work more the majority of the day. But my boss will be laughing at me. Because I have my fan, I have a handheld fan, a regular fan.
Maybe if you go on your thing.
Oh yeah, you can see.
read it
Yeah.
out.
I know something that me and Shalana was just talking about off camera, And I said that maybe sometimes, and I could be wrong, it could be what we're thinking. That I know I think of things and I instantly get hot.
Right.
Be like, God damn, I'm on fire feeling like it's okay.
Yeah. And it starts from the bottom. Like
It
that
starts
starts
from the
from
bottom.
my legs and the inside and go up. Like I can feel it when it's about to trigger. My face started glistening and stuff.
Yeah,
like,
yeah.
Yeah.
But I
I
think
hate it.
that might be something that we may be feeling at the time that could trigger a hot flash.
Yeah. And what you consume.
Yeah.
What you consume.
Yeah. Because it
raises your pressure. It raises your pressure.
Yeah,
And then
it
next thing you know, a
causes-
hot flash come on.
Yeah.
And you
Yeah.
gotta calm
It's a
yourself
And
down.
you gotta kind of like, woosah.
Yeah, like my doctor told me like certain things, everything that I love is a trigger for menopause. So chocolate, because of caffeine, any like pop, anything with caffeine, chocolate. What else did she say?
Alcohol.
Alcohol. Yes.
But look, alcohol is what we use to kind of combat this
Yes,
shit, 'cause
and that's why
every
we
day
still,
is
it's a
hard.
trigger. But that's why we
Yes.
get triggered because we consume the alcohol. Look, and I love chocolate, you know, all that. It's a lot. It's a lot, and I can't not do it. Yeah, it's hard.
Yeah. I mean, I think we really gotta. It's hard from the day to day,
Yeah.
because we don't talk about what's really bothering us.
Yeah.
And I think a lot of that exacerbates our perimenopause issues.
Yeah, and it's the emotional thing.
There you
it
go.
Make
That's
it
my part.
emotional. Cause I be all over the place. Sometimes I can be nice and like sweet as pie.
Yes.
And then 1 minute I can just be mad, just like
Okay.
mean.
Right,
just
ready to
nasty.
fight.
That's
Yeah.
because you thinking
Yeah.
about
Yeah.
stuff.
Thinking
and
is
you
what
thought
you
about
thinking.
something.
Yeah.
And
Internally.
Yeah.
Everything.
But
well,
I
I'm
try
sorry.
not to, you know, I try not to let it get the best of me, but I just stay away from people. I just try not to be around nobody when I'm feeling
Right.
that mood.
Exactly.
You know,
That goes
'cause you
back
don't
to
want
what
to
you
take
said,
it out
stay
on
away from
nobody.
people that energies.
Yeah, the energies, but it's difficult too because I think that your family does not
yeah.
understand like
They don't
really where
understand
you
that.
coming from, the people that you really love. Like, it's not that I don't love y'all. I have to pull back right now. This is how I
Self-care.
regulate. This is how I am able to focus on my Monday through Friday. You know. And I don't think that a lot of people realize that, and I don't think they realize it until they get there.
They go through it.
They go through there. Like my mother and my grandmother are very, very understanding because they have been through that. You know, but younger generations just don't understand this. And, you know, we could talk about it like this, but it's just something that you have to experience
For yourself.
for yourself
Yeah.
to really understand it. Like
That's
this.
what a lot though. Like
Yes.
Yeah.
people won't understand until it happened to them.
So
or
it's
they
laying
are.
under that same seat. That's true.
And then the husbands or the significant others, they don't
Right.
understand
And the
either.
kids.
The
Yes.
kids too. I'm just saying.
Right,
Not just
yeah.
mine.
Right,
Wasn't
like,
shy,
in-
wasn't
in
shy.
general,
Wasn't
like,
it?
yeah.
I'm just saying, like, literally, they don't get it. Like, I tell, you know, Zil to read up on it so you can know what I'm going through. And he'll read up on it. But then it's still a lot of stuff that they don't say. Like in Google or whatever.
Right.
It don't say
Yeah.
everything that you go through. And it's different phases. It's different phases, different times. So
Hell, it sounds like y'all don't even know what y'all going through.
We
we
don't.
don't.
Okay. Every day is a different day
It
of
is. It really
living
is.
in it. Shit.
We just don't know.
So it's
Like,
like, in real actuality, you can't really explain it to them, honestly. Because like we just said, y'all don't really understand what y'all got going on to a certain extent. But the thing about it is, like, when you're around people and you dealing with certain things or whatever the case may be, it's like, listen, I'm dealing with something I can't even explain to you what I got going on. Just give me a moment. That's it. That's all.
yep. or several moments. Because sometimes
Yeah.
that's what we need.
Right.
Several moments.
Just leave me the fuck alone for the rest of the night.
Right.
Leave me the fuck alone for the rest of
Let
the
me tell
night.
you when I'm ready to talk.
Right.
Especially when you work. You done work 8 or 10 or 12 hours.
Right.
And then you want to decompress. You need 30 minutes just for some me time. You
Yeah,
might want to be
woosah.
quiet
Yes.
or shit. might want to sit on the toilet for about 15, 20 minutes.
There you go.
Listen
It's in
to my
your
legs
car.
going on.
Yeah.
I know them legs
Yes.
No, I'm saying,
static is.
Yeah.
This motherfucker.
your ass like a cow when you getting up.
No, seriously though, it's like it affects so many different things. Your mood,
I'll be
the
about to fall
mood
back on
swings are the
the
worst.
Yeah.
Mood swings are the worst. And then if you two women going through the same thing at the same time, they kind of like
I ain't
a
got no
pit bull and a
doors.
Rottweiler. Like
Oh,
it's not a good thing. It's not a good thing.
it's
I'm kind of glad I got a boy.
Yeah.
But it's harder too, even with I found with my boy, because he's very sensitive to what I'm feeling. He's
Yeah,
like,
yeah.
Mom, are you okay? You don't feel good, and it makes me feel bad. Like, oh, I need to pick it up and do this and not be myself. But it's
That kind of reminded me, because
Yeah.
let me tell you something. And I laugh about it now. I used to laugh about it back then. Whenever I'm on my menstrual cycle, because I have fibroids and I clot really bad from it and stuff. My son would be like, "Oh, you on your period, huh?" Because I become like the most meanest, and it's not on purpose, but it's like my entire body is hurting, or whatever the case may be. It's like, if you talk to me, breathe on me, breathe,
Yeah,
do
like, don't
anything, it's
talk.
like, please
Like, shut
just
up.
get away
Yeah.
from me. And it's like, he don't understand. He just be like, oh, he slammed the door because he mad, because he looking like, I need something, and you irritated, and I ain't even did nothing.
You got an attitude.
Yeah, and it's not
For no
purpose. I'm
reason.
hurting right now.
Yeah.
I don't want to talk.
I get it, but we also got to be patient with them.
Yeah.
We got to be patient with ourselves, and we have to be patient with them because they don't know.
They don't.
They
Yeah,
don't know.
right.
They just see we moody. They just trying to ask for whatever they trying to ask for at the moment.
You want something to eat. Boy, you don't want to make your own food. Mom, what we finna eat? Nothing. I don't know what
Right.
you gonna eat. And then I be full. I don't be want to eat some days on my menstrual. I feel so full, I don't want to eat nothing. So guess what? I don't want to get out the bed and make you nothing. This sound mean, y'all, but my son's 18. I'm not getting out my bed.
I feel you.
Go in
Shit,
there
I
and
don't get
figure
out
it
my bed
out.
for the 10-year-old.
Every man
Like,
be at I'm gonna get you sucker.
Exactly.
Remember when no girl, he was like, what the hell is wrong with you? She was like, crabs. He had the mom feel like that.
Right. Ooh, baby, I felt like that a few days, okay? Yes. Well, some helpful tips with perimenopause.
okay.
They say is stay active with regular movement, which is something you said. Y'all said walking, doing some type of exercise. Eating plenty of protein, calcium, and fruits and vegetables.
Okay.
Stay hydrated. Practice stress management through prayer, meditation, and journaling. Something I've been trying to do. And
So you
talk.
been meditating and writing and journaling and praying?
Yeah.
No,
I have. I can't tell y'all who I talk to.
Go right.
But that's a part of my journaling.
Yeah.
So look, try also like YouTube. Like when I get up,
You was outside when we was talking about that.
right?
Oh, sorry. I missed the whole discussion, but go ahead.
Like I listen to a lot of affirmations in the morning on YouTube.
Positive.
Yeah,
Positive.
I try my
That's the best way to
every
wake up.
morning.
You gotta
It
set
is.
the day, yeah.
But sometimes it's difficult to do that. Sometimes
Yeah, it
I'm
is.
just like
Some days
rushing,
you-
like
Yeah.
You don't have time.
Oh, I hate
time.
rushing.
You know, when you just don't fucking want to get
Yeah.
up. You want to do
That's
nothing.
part of that.
Some days
You
you
just
just wake up
wanna
with
go to
attitude.
sleep.
Menopause.
Yes.
You don't want to get out the bed.
Yeah.
Or you
Yeah.
be dragging. Like your
Yeah.
energy be low.
Yeah.
Yeah, I hate it. Oh, I
Yeah.
don't wish it on nobody.
So what are some other tips?
Talk with your healthcare professional about treatment options if symptoms become severe. So
I got a question about that. Do y'all think that, because this is one thing that I learned from Monique. Monique had this doctor. I don't remember her name. Was it Dr.
yeah.
Jones?
Dr. Jones, love
Alexis
Dr. Jones,
Yeah,
baby,
she's dope.
baby.
What she's an advocate?
She was at
She was a black
company.
got
She
a
was at
black
Little Company.
advocate.
Yep.
Is she not there
Did
anymore?
she? No. So
Oh wow.
she left Little Company. Then she went to Silver Cross. Then she left there. Last time I talked to my friend that talks with her, she said that she was trying to open her own practice.
good.
I got to follow back up with her and tell her to reach out to her, tell her, because when I say Dr. Jones was very personable,
Yeah,
she
she
was
was.
very. I came to her 9 months pregnant. I'm like, I'm about to leave, go to another doctor because I think I had a cold at the time, and I was like, I needed to take my kids to the doctor because they had pink eye. She was like, Monique, I'm finna give you a script for your cold and give the kids a script for their pink eye. I ain't even have to go to another fucking doctor.
Yeah.
But I said that to say she really took care
very
of her patients, and she wasn't like trying to get you in and out. She tried to know what's going on with you personally. I mean,
That's good.
she knew everything that was going on with me and everything. You know what I mean? Yes.
Try to help you out in your relationship. Of
Yeah.
marriage,
Yes, she
too.
do.
give you
It was
great
times he would
advice.
She was
come
a doctor
to me.
and a therapist.
Yes,
Yeah.
it was times that I would come with her with my husband to her, and she'd be telling him,
Yeah.
"Look, get on top of your stuff." So
Yeah.
she was
definitely
like one of the girls.
She was.
I said
Baby,
that
love
too.
her. Alexis Jones,
Tell
get
her
back
to-
in the office or come to my
I
house.
was saying that to say, like, when she said something about having a conversation with your doctor. Some doctors, I was looking at something online today. They just be want to give you whatever because they get paid for this. But I was saying there are some good doctors that will help you, teach you. They will, let you know what's really going on with your body and different things like that. Like Monique said, very personable doctors. And I was just saying that because Monique is the one of the people that was telling me about a good doctor named Dr. Jones that always will tell her about this, and that, and educate her on stuff. A lot of doctors don't educate you. They just want to medicate you, but they don't educate you.
Yeah.
But you have to find the right doctor for you to educate you on what's going on. And that's very important. Like, don't just, my doctor said I got to take this medicine.
Right.
No, get to know what's going on with your body. Get to know your doctor.
Read up on what they
And
say
advocate for
first.
yourself too.
Advocate for
Let
yourself.
them know, like, no, this is what I have insurance. Look, I'm telling you what's going on with me. You can't tell me how I'm feeling on the inside.
Nope.
And if I don't have insurance, treat me
The
as
same
you
as
would
if I
want.
have insurance.
There you go.
Yeah.
Yep.
I agree.
Absolutely.
And it's kind of good to have a female gynae because they go through what you go through. You know, they know your body like how you know your body. So
It's good to have somebody that's just a good person.
And
Yeah.
understands because
True. And listen.
I'm not gonna to keep throwing his name out there, but Dr. Pierre Johnson, I seriously, he understood where I was coming from. It is within him. I don't know how he understands. He tells his story, but I felt comfortable.
Isn't he
You
the
see him
fibroid
now?
doctor?
Yes, that is the
fibroid,
fibroid
yeah.
Oh, okay.
Yeah.
Dr.
Who is he?
Pierre, Dr. Pierre
Where he at?
Johnson.
Loretta.
I believe he was at Loretta.
And he's a fibroid doctor.
I need to
He
go to
specialized.
He
after that.
specialized.
After this, I need to get his information.
Yeah, he an
But he
OB-GYN, but he
really,
specializes
he really
in removing
listens.
fibroids.
He really
He
listens
called.
to you.
Okay.
Yes.
This is y'all hear it
Yeah.
out there, right? Did y'all hear the doctor
Yeah.
name?
Dr. Pierre Johnson. Hey.
He do what he
Well,
does.
we're gonna say his name again because
Okay, gotcha,
we're about
gotcha.
to talk about PCOS right
That's
now.
right.
And then we're gonna talk about fibroids,
Okay.
and that way we can shout him out again, and y'all can give a little background
Okay.
on how y'all deal with fibroids. So PCOS, I just recently found out they changed the name to it. I can't think of the name offhand, but PCOS has always been known as polycystic ovary syndrome. It is a hormonal condition that can affect ovulation, fertility, metabolism, overall health. The common symptoms of it is irregular periods, weight gain, acne, excess of facial hair, excessive facial hair, body hair, hair thinning, difficulty becoming pregnant. This is kind of near, not kind of, but a lot near and dear to me because this is something I was diagnosed with from Dr. Jones. when I was pregnant with my second to last daughter, I think Kai, and she's 15 now. So when she told me I had polycystic ovary syndrome, I'm like, I don't know what that is. I just knew I had this belly that I couldn't get rid of. But I was like, is it diabetes? Because she would be like, it has something to do with your insulin and your body being resistant to insulin. So I'm like, well, I know diabetes running my family. Am I gonna have diabetes? Thankful to this day, I don't have diabetes. I've always been told, well, not always been told, but I've been told that I was pre-diabetic. So I'm working on things to not be diabetic. I'm catching it before it goes. But yes, PCOS, it is very hard to deal with. One of the things that it don't say on here that I do deal with is a little bit of depression. And it could be triggering, I think, because of all that I went through, losing my son and everything, because I really recognized the depression when I lost my son and couldn't get out of bed. But the PCOS part of it, the weight gain, yes, that's the reason why Big Mama get the big belly. But it's okay. Cause I still pull niggas with it.
There you go.
Okay, and I love me no matter what, baby. Okay, it don't even matter with a belly and all. But it is difficult because I haven't experienced. I did experience hair thinning. That was like when I was 30 something, 32, 33, and I was like, why is these patches of hair? But I'm gonna say this. I was dealing in a stressful period at that time. So if I'm dealing with PCOS and I'm dealing with stress on top of that, that's triggering all of that. Now, I've learned to say, fuck it. If it don't mean positive things to me, fuck it. I'm not going to let it ponder in my mind. So I haven't experienced that. My hair grew back, of course, and I haven't dealt with that ever since. The facial hair. It's a bitch. Okay. And it comes even more to me, I think, because you can see it more because I'm lighter. Like other people tell me, I had a client tell me the other day, she like, oh, I have facial hair and it come, I gotta pluck my hair, I get it waxed and everything. And I'm like, I'm looking at her, I'm like, I don't see what the fuck she's talking about. But she's darker skin, has darker skin, smooth, clean skin. But what you was gonna say?
When you put that makeup on, just like when you get professional makeup, you can see that shit. It comes up like darkened, black.
Yes.
You can see it like y'all. My little I got a mustache.
Yeah, I got a mustache. I'm not shaving it.
I shave.
I get mad wax.
You shave your? You do?
I
get mine waxed, but
I get mad wax.
waxing, bro.
I do.
Ain't nothing gonna
I get this wax. If I got some,
I get it every time I get my brows.
Y'all will never hear me say, "Oh, my little mustache sweating."
Yeah,
I say it all the time.
Yeah.
But I do shave and I do waxing. It might look a little bogus right now.
It don't look like y'all. I'm looking at
Because
y'all.
I just probably waxed it not so long ago.
Y'all skin is gonna come back thicker.
It never gets thinner.
I think that's a
After a
myth.
while, it
It
gets
don't come back.
thinner.
You just
Yeah,
gotta-
after so many times again, it gets
There you
thinner.
go.
You're a man,
And they
so
tell
come back
you
to
that.
very long.
Yeah.
And then when you get it done frequently, then it's not gonna
It's
come
not
back. 'Cause
gonna-
it gets accustomed to the routine.
Yep.
Yeah.
So like I get mine done like every 2-3 weeks.
I
maybe.
don't know. I just can't.
It don't hurt.
I don't want to look like Miss Pearly.
You're not.
You're not.
If you don't do it, you will.
You're not. Yeah.
Okay.
Girl, look, I'll be like, ready, set, go.
Okay.
You do it yourself?
No.
Oh, girl.
Well, I do. In between, I do it. You know,
To keep it.
Yeah,
So
but
you wax yourself or you just shave it?
No, I wax myself. I am so scared of shaving this part.
Yeah.
Like I.
Yeah,
I'm
now
not
you
gonna
shaving
shave.
that
You
shit
gonna get
gonna
a
come back
beard.
thick,
Yeah.
right?
Yeah.
Cause you
I'm
shaving
shaving
other
it.
hair that
Between
ain't there.
waxes, I'll take the
That'd be-
little
I ain't doing
razor
none of that.
Now I do this.
Open it up
I'll
and
do
pull.
this, Keita, but this part I do not touch with my razor. No,
I
at all.
do.
I
Them
do
little
this.
razors, the little
You
eyebrow
razor this.
I will if
I don't get a lot, but I don't get a lot, but I get like little whiskers here, and I like take the little thing and do that.
What about a trimmer?
I do tweezers.
I
I don't get that. I don't get that
I
much. You
tweeze
can barely
the
see
shit out of
it.
it.
It's like
Girl.
small ones. And I noticed the other day I had a little gray hair right there.
Now I've been having a gray hair. It come. You see it? Because I ain't get it yesterday. You don't see it.
I got
It's a
some
little
that-
white when they
hey,
come
I
on
welcome
my face.
Well, mine
I
comes.
got
a bunch of gray hair in my
all
head.
my perimeter.
See it right there?
I ain't worried about it. You getting up
Yeah.
there, Keita?
Yeah.
Okay.
You joining the
Y'all,
crew?
I know y'all said 40 hurt. I'm scared.
Now it hurt.
But I want to say this because about the irregular periods. Now, I think overuse of time of birth control that bring on things too, and I think that brought on this polycystic ovary shit.
Because it manipulates our hormones. That's why I never got on it because I didn't trust
You
it.
never
because
had it at all?
Never. I tried the birth control one time, and the same day when I tried it, no, I'm lying, twice. I tried the pills. They made me feel like I was pregnant, like morning sickness. I was like, yeah, no, and I didn't even do that for like a whole month. I just didn't like how I felt.
Okay.
And then when I was in my 20s, I tried the Nova Ring.
That's
And the
NuvaRing, babe.
and I took that out immediately because I just didn't like.
And so it was
terrible.
And as soon as I took it out, I got pregnant.
Really? For over a year with that.
Y'all don't want to
So
hear
I was like,
I
yeah.
I got a horror story.
So for
I was
me,
like that from the Depo shot. It made
I
me
sit
believe
back and
for
I'll be
6 months
like,
straight.
thanking God, because
Yeah.
hallelujah. I got on the NuvaRing after I gave birth to my son 18 years ago. And I just stopped taking it in 2024.
Wow.
Damn,
Right? It was a long time. And yeah, so back in 2023, I had took it out. Well, when my fiance died in 2020, I was off of it. 2020 to 2023, I took it out. I put it back in 2023, or whatever the case may be. And then for a period of time, I took it out, and then I popped it back in. I got pregnant. And then when I got pregnant, or whatever the case may be, it was, I had it it didn't really, I don't know if my body the doctor pretty much was saying that my body didn't take on to the estrogen and the NuvaRing quick enough. I don't know if it's because I was in and out of it. I don't know. But, I ended up getting pregnant from that. And then months later, due to some things, as well as the birth control, I ended up in the hospital with blood clots.
Yeah. Birth control classes.
So it was the birth control and some other things that was going on in my body. But it was just like, I haven't been on it since then. And I'm never getting back on it because that stuff really causes a lot of trauma to our bodies, whether we want to
Because it's
believe
a
it or
foreign
not.
substance that we put in our
Yeah.
bodies to manipulate.
I almost
and
died
this
from it, so
lady,
I'm scared now.
this lady on TikTok, and I love TikTok because you will it's
Thank God I'm
somebody
here.
out there experiencing something you going through
Yes.
or dealing with something.
Yeah.
And you can learn a lot. And she was saying like people that have the big C word lack estrogen. That's what they say with breasts. Not cholesterol. I'm like, what's the big C word?
Right.
Yeah, she said they lack estrogen, and she was saying like doctors be like, well, too much estrogen causes it. But she said, what if they lying? What if you really
What if they
need
lying?
it,
Yeah.
and they're just telling you
They
that?
want some money.
Yeah, because I'm sorry, I just believe in natural. First of all, our bodies were designed to heal themselves, and I'm a firm believer in that. Can't nobody take that
Oh,
away.
yes,
because I
me
have
too.
experience with my own body on healing certain things, and I've seen the miracles. So I'm gonna stand by that 100%. But yeah, a lot of times I feel like when doctors are quick to write a prescription, follow your gut and just like try to get a second opinion, or just sit and try to figure out and read up on whatever it is that you're feeling or what you may be lacking to try to help yourself. Yeah.
I feel you on that. Birth control is just horrible.
Yeah.
Depo messed me up.
You messed a lot of people
Depo had
up.
me bleeding for 6 months straight. I went 3 days without bleeding every month. So I had to, and it caused me to have acne. I gained weight. Oh, it
That
messed me
stuff be
up.
messing us
Then I
up.
got off that with the pills. I got off that. I did that for about a year. After I got on that, because I
pregnant
kept
on the pill
forgetting
with my
about the
son.
pill. And then I got on that patch, and the patch was strong though. The patch worked for me for years. until I got pregnant, and then it started making me feel like I was pregnant because I
that's
had
how
morning
people get me.
sickness,
I know that
and
feeling.
it made me go through a whole lot. And then I got off
never
that
been on
and
birth
got on the
Yeah.
what's
I
that
don't
thing?
recommend nobody getting on birth control. That's why we in my house.
I got it.
It's just
Paragard.
It's not the Paragard one. I had that one. It's the 7U.
IUD. I mean,
I got an IUD.
I've
But
tried
Is that the
every
thing in
birth
your arm?
control.
the thing that's going your.
They put it in.
I'ma
No,
speak on
it's
that.
an IUD.
Yeah.
Okay.
They
Yeah.
put
Okay.
it inside.
Yeah.
Marina?
Oh, is that little
Is that
white
the same?
thing?
Yeah, it's like
Marina
it's shaped
goes
like
inside
the,
it.
Yeah.
Right, Marina and the
Max
Paragard go
is
inside.
Right.
Yeah.
Wait, they implant that up your vagina?
Yeah.
Yeah, they do.
It's on your uterus.
Oh, hell
Yeah,
no.
Girl, but I ain't get pregnant off of it.
But I
It
don't want
worked.
them inserting. I would, like the new ring, I was
Thankfully.
inserting them. I would rather put that up myself.
I ain't
No,
like how that
I just
felt. That's
wanted
why I
to put it
said,
in
yeah, I
me
won't be
one
doing
time.
it.
Yeah, but it was
and
uncomfortable
when it's time to
sometimes.
take out years later. That's it. That's all. I don't have to be responsible for remembering nothing.
Yeah.
But
I-
it's another podcast, but why do we got to do all of
Why we
that?
gotta do it? Why we gotta do it is the main
Why? Oh
real
my God.
of it.
Why do we
That's what I
have
was
to
gonna
alter
say.
our natural bodies?
We shouldn't.
You know,
we shouldn't.
But if we don't use preventive things, then you could be real fertile and keep getting
There you
pregnant.
go.
You gotta
Which is,
understand that that's
was
just
me.
God's plan. But
Yeah.
then I mean that's just God's
I know,
plan.
but God, I couldn't take y'all
no,
kids
look.
that I sent to you. I'm sorry.
Oh my
okay,
God.
I'm sorry.
That's another podcast.
I did. That's another podcast. I'm sorry, God.
Go back.
but that's the realness of it.
Yeah.
I was saying I tried every birth control except for Depo because I heard horror stories of
Yeah,
it.
make
Your
your
hair
hair
falling
fall
out,
out, yeah.
weight
That's what it
gain,
did to me
everything. The last birth control I tried, your girl had an abortion. This was before my last baby I just had. That's why she here. But I had an abortion. And my husband was so mad at me for having that abortion that a month or two later, I'm working at work and I feel blood just running down my legs. I'm like, what the fuck is going
I
on?
remember that.
And I go in the bathroom, I clean up, put on the pad, wash my hands, go back, finish my client. Then I feel something big just come out of me. And I remember they would say, if you ever feel a blood clot or see a blood clot bigger than your hand come out, that is going to the hospital. That warrants for going to the hospital.
Right.
So went in the bathroom, I passed that. I went to my doctor and she was like, she was like, she didn't see anything going on, but she was like, we can give you a birth control to try to stop the bleeding. She gave me Nuvaring. Took Nuvaring. 2 weeks later, I'm at home by myself. I walked to go in the living room, but I started feeling really woozy, like I was finna pass out. And the Nuvaring came out my body as I was walking.
Wow.
I hurried up, went to the bathroom, sitting on the toilet, and I was finna die. Literally, finna die.
Oh my God.
I was so scared. I called my friend Tony. I think I called my cousin Brian because he lived down the street too. And I called at the time I was living in an apartment building. I called the manager of the apartment building because I was like, if I'm in here by myself, and how's they gonna be able to come in and get in the apartment? So I was like, I'm feeling like I'm finna pass out. Can you open my apartment door and can you call 911? No, I was like, I already called 911. So my cousin, my friend get there, and I blanked out after that. Got to the hospital. My mama came to the hospital. Dad came to the hospital. What happened was they left pieces of the baby inside of me.
That's what happened to me.
Left pieces of the baby inside of me. They had to do a DNC. And they thought that they were going to have to do a blood transfusion because I was losing so much blood. They ended up not doing a blood transfusion, but thank God to my mama because she is such a health guru. She told me take blackstrap molasses. Look, that weekend that happened to me and my mama came over, my mama took care of her baby, okay? Made me breakfast,
Ooh, I know
gave
that
me
sounds
all the
good.
health tips that I needed and got me back to life. But that blackstrap molasses is something that you can take to help with your
That's good for
iron
iron,
and
yes.
build it up. She put me on to that.
Where
but
can you get it from?
you can get it from health food store, Sunrise Health Food Store, or you can order it online on
What is it
Amazon.
again?
Blackstrap molasses. It's
Blackstrap
like it
molasses.
looks like a syrup.
Okay.
It don't taste bad. It tastes a little sweet, but you can mix it with orange juice if you want to, or you can take a shot
I
of
need
it.
to get it for
But
How long do you have
definitely
to take
get
it to help with your iron?
I didn't take it. I ain't even gonna lie to you. I think I probably took it for like a month or two.
Okay.
But what I liked about the blackstrap molasses is that versus taking iron pills, it doesn't have you constipated.
Yeah.
You had a regular bowel movement when
There
you
you
would
go.
take it. So
Okay.
that's something if you want to build up your iron, boost it up, your immune system too.
Okay.
It will help with that. But yes. After that, I didn't take no more birth control pills. That was it. Kaden is here, and she is the last of the Mohicans, okay? But those are my difficulties with dealing with PCOS. I know y'all not dealing with it, right?
No.
I don't wish it on nobody. For the ones that deal with it, that have fertility issues, don't give up. I know you're probably trying to have a baby. Don't give up. Don't give up. Talk to you. Get you a good doctor, first of all, that's going to help you through it. Because with me dealing with it, with my second to last baby, I had it then, but I got pregnant, of course, 2 times after. So they'll tell you you can't have kids, but only God will make you, make a way for you. I wasn't trying to have kids, but I mean other children, but she's here now, and I love her dearly. Love you, Kaden. But helpful tips with that is focus on balanced meals with lean protein and fiber. Exercise regularly. I need to do that. Keep up with regular medical appointments. Get enough sleep. Remember that PCOS is manageable with the right care and support. Fibroids. Let's get to it.
Ugh.
I think
Now
everybody
you had
has
just
that
said,
experience.
because I know we probably all have heard this from doctors. Oh, if it's anything bigger than a dime or a quarter, yeah, you need to call 911. But when you have fibroids and this clot's falling out of you that's like the size of your palm, they like, oh, that's normal. No, that's
it's
not
not.
normal.
It's not.
Yes.
It's
And
not.
I'm sitting over here losing all of this blood, ferritin low, iron low, all of this, literally dying on the inside, not knowing that though. And all they saying is that's normal, we could do a surgery. No, how about we figure out what the root of the problem is. So before you just cut on me, because you could cut on me, but if we don't get to the root of the problem, the problem's gonna come back. So fibroids is the devil. Like, I am so serious. I found out that I had fibroids in December of 2019, and the day that I found out I had fibroids, I found out I was pregnant with my daughter. And so I'm like, oh my God, what am I gonna do? And they was like, well, usually when you're pregnant, the fibroids will just move out the way, or like go away or dissolve or something like that. But no, that didn't happen. And I've been dealing with them since 2019 when I found out about them. And I've had the worst periods. I would literally be bleeding for like 16 days. So just imagine you bleeding 2 weeks out of the month, and then by the time you're done, you trying to build yourself back up
And then
to
here it
get the
comes
strength, and then
again.
here it come again, knocking you down. I'm literally sleeping all day. That's not good. That was the number one sign, fatigue. Like if you're overly tired, please go seek medical attention. Not in an emergency way, but like make an appointment with your doctor to ask them to run labs so they can see like what's going on with you. But just tired, body drained, pulling so much from you, and it's very, very depressing. And like I said, by the time you try to get yourself built back up again, here it comes. Now, by the grace of God, I have had 2 normal periods these last 2 months, and I am so happy. I don't know if it's from this hormonal tea, because I'm on this herbal group on Facebook, and it was saying like to make a tea with the fresh hibiscus flower, cinnamon sticks, basil leaves, and cloves. You boil it, let it steep, and you drink on that, and it regulates your hormones and balance out everything. So I started doing that. And it was time for me to, get my annual checkup in May. And when I went, I was explaining to my doctor everything that was going on. And she was like, this probably why it's taking you so long to lose weight, because if like your she was saying if you're ironing, your vitamin D and all that stuff is low, it's gonna be impossible to actually be successful with working out and losing weight. So she did run all of those tests, and my ferritin was low, and I was anemic, and she told me that I needed to get on iron to build all of that stuff back up. And then she sent me to get an ultrasound just to check the fibroids to see. So I found out, now my OB-GYN didn't even tell me this, and I found out from my PCP, my primary, that my fibroid sits on top of my uterus. So it's a funnel fibroid, and I have two of them. So that's where the pressure and all of that was coming from. But then when I went and got my ultrasound done, I had cysts that I didn't know about, and one of them ruptured.
Wow.
Yes, and I didn't know that was what was going on with me. I knew I was on my cycle, and when I say I was in so much pain,
I was just gonna
but I always had bad cramps. So in my mind, I'm thinking, but I'm like, God damn, these feel like contractions. Like it just.
Thought you was
Yes,
having a baby,
I was telling my husband, I'm like, just hit me, just rub my back, like it was so bad. Like I'm sitting in 3 hours non-stop pain. I had got some weed. I'm like, I need to smoke. I need to do something. The weed actually like calmed it down and allowed me to go to sleep. And I went to sleep,
But
and when I woke
sometimes
up,
that doesn't even work. I have a daughter who goes through that, and we are at the point where we go to the emergency room. It's
bad.
It's terrible.
And how old is your daughter? I'm sorry.
No, you're fine.
She 24,
And she dealing with fibroids.
I got
No,
you,
she
baby.
has she
Just
got
real
those
bad
cysts, like
cysts.
really
Oh,
bad. She
yeah.
has endometriosis, and it's just terrible. Like
And my ruptured.
you made a point with how you were taking the teas, and when she was like juicing and stuff like that.
That's what I was gonna say. It helps.
It helps tremendously.
Yep, it do.
Yes.
And I was gonna say, like, I had did like a little experiment on myself. I was on my cycle, and like prior to me going on it, I was fasting that week. I was eating healthy, watching what I was eating, counting my intake, my calories and things like that. So when I did come on my period, I didn't have cramps. But then I started eating like chips, bad stuff, and I felt the cramps coming. I'm like, oh, so it's the food, it's what we eating. Like so what I've been doing is when I'm on my cycle, I don't even work out hard like that. I just walk for that week that I'm on. Normally because I go to the gym, but I'll just walk that week. Try to take at least 2 nice hot baths, because they say you ain't supposed to bathe sometimes, because it'll cause the blood to stop, and then you'll cramp worse if you sitting in the tub. But that tea, I can honestly say I believe that tea is what helped me. And then that cyst ruptured. Don't know what caused it to rupture, but I'm glad it didn't get serious, because I didn't know that it could have caused me to be in the hospital.
Right.
So by the grace of God, it did. And I'm like, so what's gonna happen with the fluid? They said my body is just disintegrated. So I've had 2 normal periods, and I'm praying that it just stay like that. So you could go to Pete's. They have it, the fresh hibiscus. It's in the produce section. It's from Jamaica. It's like $4. You could get it, boil it, get you some cinnamon sticks, saline cinnamon, basil leaves, and some cloves. Boil it, let it steep, and just drink on that. Do it a week before your cycle and during your cycle, and just see if it helps. Like, try to track stuff and write stuff down. Like, that helps too, so you'll learn your body and know like what causes flare-ups and different things like that.
Yes.
So
and pay attention to the moon cycle. The cycle of the moon, and because we are of Earth, and that is of it, and it makes a huge difference. Yes.
One thing I was gonna say to you, I know you said you've been working out and exercising. Do you think, when I used to heavily work out, that would help my cycle come on?
Okay.
Because of me dealing with PCOS.
Yeah.
That will help my cycle stay regular. Do you think that's the reason why your period has came twice 2 months in a row?
Normal?
Yeah,
From
normal.
you working out?
Because exercise.
Because
along with business.
Because all last year I was working out constantly, consistently, 3 or 4 times out the week, and my periods was lasting for 2 weeks, and I'm like, what the hell is going on? It was so depressing. I could be sitting here and I could feel it would be like you could feel like it, like you passing a little baby or something through,
Right.
and then just blood is gushing out, and it's so. Oh, I'm talking about. I'm showering, not knowing that these clots is falling out. My husband like, oh my God, scaring the shit out of me. Because he
could be traumatized.
Yes, and I'm just, it's so, oh my God, it took so much. But I honestly believe that tea has been helping me because ever since I started drinking it, I've had normal periods. And I even give it to my kids now. I'll do it and then I put it in the refrigerator. I make a really big like gallon in the lemonade picture. And I put it in the refrigerator because too hormones and all that, it's a balance. So it's not gonna harm them. And then I'm getting into herbs. So, like certain herbs and different things like that calm your mind, anxiety. I'm gonna start making teas for that too, for my kids, so that they can, relax and calm them down, so that they could be able to focus. And I'm gonna just experiment and see how that work on them, and go from there. But fibroids. Oh God, no, it's not. And people don't. And then too, I realized sugar. Makes them grow and feed it. Cut the sugar out.
Yeah.
If you can't cut the sugar out, like I rather eat my calories. I don't try to drink nothing, no juice, none of that, unless it's like if I'm out being social. But on the regular, I just normally try to drink water
when you at home.
So if you can try to cut out as much processed food and sugar, like sugar literally grows it.
They feed into
Ain't that crazy? Sugar do a lot of things.
Diabetes,
everything.
It's
bad.
Yeah.
The things we have to go through.
As women.
And you know
We
what?
go through a lot.
We saying this as women too. I don't think that we realize that men go through some things.
They do.
that
They
are
do.
not necessarily
I wouldn't take that from them. They do,
as what we're going through, but they go through those hormonal changes.
Oh,
Of course.
Especially when they get older.
Exactly.
Testosterone
So,
probably dropping.
It's like it's a human thing, and it's. But I think, as you were saying, like we need to be mindful of what we're eating, what we're putting into our
Most
bodies.
definitely, that's the number one thing.
Yeah, I think that's very.
I agree. Well, like you said, helpful tip: track your symptoms. Write down, what you're going through, what you're eating, and everything. Discuss treatment options with your healthcare provider. Eat iron-rich foods if heavy bleeding causes anemia.
Yes.
Blackstrap molasses.
I'm gonna get some of that.
Blackstrap molasses.
Beets.
Yeah.
Beets help too.
It's the worst, but beets are good.
Beets
for
help is helpful
Beets
for
taste like
a lot of
dirt.
stuff.
Now I eat a pickled beet.
Any kind of beet.
Really?
I don't. Oh,
I don't like
my
it.
yeah.
It tastes like dirt, right?
It just tastes like a bland.
like dirt.
Like dirt. You can tell from the earth.
Yes, but
tastes like earth.
I like it. Yeah.
Yeah.
I used to hate it when
The
I was
nastiest
a
stuff
kid.
was mostly the
It's
best
good
was
for
yeah.
you. Like liver and all that stuff.
I used to have to eat that as
blood.
kids.
No want no
Thanks.
liver.
sorry.
Blackstrap molasses. Because I can't do it. My daddy used to force me.
Yes,
to
we
eat
used to
that
have to
shit.
eat that when we were little.
Yes.
It's like a taste. Ugh.
Yeah, very.
I don't like it. It
reminds
tastes
me
like
of
a liver.
gizzard.
And
Yeah, right.
It reminds me of
I don't
gizzards,
even
but
know how
like cube steak. Like cube
Nah,
steak.
hell no. I
Like
love
if
me
you
some
put
cube
gravy-
No, cube steak don't have that.
It's a
on it.
taste. It's
That-
like
that-
when you bite it.
That animal taste.
Yeah, it's
Like lamb chops.
Like gamey. It's a
If they
gamey
not
taste.
lamb chops got that taste too.
Yeah, I don't like
ain't
lamb
fuck with
chops.
them
Not
either.
all.
Me
They not
either.
cooked
They too
right.
musty.
They not
If
cooked
they
Yeah.
cook right,
No,
they taste like that. But if they
No.
cook right, they don't taste gamey. I love lamb chops.
I don't like
But they don't be gamey.
You know, I
They
love me
taste
some
right.
lamb chops.
Yeah, they gotta be cooked right, the right way.
Save that.
Yeah.
I know you spoke about your daughter dealing with endometriosis, right? I know a few people dealing with endometriosis, but so for people that don't know what endometriosis is, it happens when the tissue, similar to the lining of the uterus, grows outside the uterus, often causing significant pain.
That
which
sounds painful.
Yeah, which you just said
Yeah.
she's dealing with.
Damn.
How?
I don't know. I don't, but like she was saying, you really have to be mindful of what you put in your body, because the better she ate, she juiced and watched the processed foods that she was eating. She did not experience that. But what we also don't realize is that the stressors too, because when she was stressed, whatever it was, it made it come out even more.
And our bodies hold on
Yes,
to that.
our
It gotta come
bodies
out
take the
sometimes.
score of whatever we have been dealt with from the beginning.
Yeah.
So I realized that when she excluded all of those things, she better deal with it. But we all go through emotions and how we feel and how we handle things in our body. But that's what I've noticed with her, that when she eats well and she excludes all the stress, and it doesn't matter who it's from or who it's with,
It's just
fine.
stress, yeah.
But other than that, clockwork every month, 2:00 in the morning, crying in a fetal position.
Oh my God.
And it's
I
like,
can only imagine.
yes, like we have to go to the hospital. We have to. That's the only way that she would get relief. I would have lavender smells in the room, Midol, all of that, but it just was not enough. It was not enough. Like you mentioned, weed, it just was not enough.
Yeah.
Do she still deal with that to this day? So when she goes to the hospital, what do they give her?
They give her
To make
an
it-
anti-inflammatory, because that's what it is.
It's inflamed.
Yes, it's
But what
inflamed.
caused the
So
inflammation? Probably
there
something
you
she
go.
ate.
There you go.
Or
On
stress.
Dairy,
Stress.
dairy,
Yeah,
dairy.
dairy,
Processed
yes.
foods, all of our
Yeah.
foods these days, we don't know what we're eating.
And the animals be
drinking.
stressed out too, and
There
they'll
we
kill them
go.
and then
Yes.
feeding them to us.
There we go.
They
Yeah.
giving them antibiotics.
So they
and
give
guess
her-
what?
And some people
We
be
can't
allergic.
fight it. We can't fight. Our bodies can't take on the antibiotics because we eating animals that have that.
antibiotics.
So we already have a little bit probably in our system
and
from
we
the
fight
animals.
against it,
Yeah.
But damn.
Anti-inflammatory, and it's a shot. Usually just
Work right away.
That's crazy.
Just
though.
they can't give it in a pill form so that she can have it
Right,
on
as a
site at
prescription.
home
Yeah.
when her cycle comes, or to
you
prevent.
know what they offer? Birth control.
Yeah, that's the first thing they want to
Because
do
it is,
when
yeah.
you're going through fertility issues. They want to offer you birth control. I don't want
Right.
nothing to manipulate how my body is supposed to function normally. No, let's figure out what's going on. Let's-
Because that's gonna do some other stuff.
exactly
Mess up
It's
some
gonna
other
mess up
things, other
something else.
functions.
Yeah,
So
yeah, that's horrible. Oh,
I feel
hate
so
that she gotta
sorry
go
for
through that.
yeah.
Yeah, I had that when she.
But to be honest, I think
it's bad.
I think we human beings, just in general, should at least fast once a month until we can build up enough strength and discipline to do it multiple times out the month. Because it's only gonna help us. If we stop eating, just push the plate away and allow our digestive system and all our organs and everything to just calm down from eating so much. Because I was literally thinking about this today, like, they have certain charts where it'll tell you if you eat certain foods how long it takes to digest. But just think about, like, if you out and you being social and you eating and then you ate that, and then 30 minutes later now you snacking or eating on something else.
Yeah.
You ain't even give the first
Rid
thing
of,
time
yeah.
to digest. So now your body, your organs and stuff is like working double trying to, and then that's how you get constipated. And we should be making bowel movements too, like daily. Every time we eat, actually, every time you eat like a
I was just
baby.
about to say.
Every time you eat, at least, and then if you only making it once a day, that's bad. But if you
get
ain't making
colonics. Get colonics.
yeah,
You know what? Sometimes colonics does not even work because we have not.
blockages and shit.
Yep.
Yeah.
That part.
You got so much.
You got so
Something
much. You
backed
just
up.
basically
You be
full
full
of
of
Shit.
Live.
But that could cause anger. That could cause
will
anger
help
too.
Yes.
Yeah.
Being
Yeah.
backed up full
Yeah.
of
Oh
shit.
yeah.
But
Cause
you be
fever,
backed
too.
up
Fever.
from what you putting into your body too.
Yeah.
Just like red meat, it's hard to
Oh,
break
yeah.
down.
Oh,
Anytime
yeah.
I felt like anxious and overwhelmed, just not myself, I'm like, all right, when the last time I really just let go of everything? What am I putting in my gut? Because
Yeah, it's
that's
sitting,
where it
just
starts.
sitting.
That's
in
where
the
all
gut,
the anxiety,
everything.
depression starts. It's
In
your
the gut,
gut.
yeah.
And I promise you, when you take your vitamins and you clean yourself out, you feel
So much better. You
Yeah.
don't
But
even
it is
crave bad
hard.
stuff.
Yeah, it's
Yeah.
hard of getting
It is.
into
It's a
that
mind thing,
routine.
Yeah.
It's a mind thing,
It's a
and I
mind
think
thing.
it's a daily stress.
Daily thing.
You gotta, yeah. But once you get into the habit of doing it, I think like you, if you make it a part of your routine,
Yeah.
then it'll help. Yeah.
That's one good point you made about fasting. And then maybe, like you said, once a month, then gradually
Yeah, build
going
yourself.
multiple times. Yeah, that's a good thing to do.
Yeah.
Definitely.
Fasting, meditation, prayer, because only prayer gonna help you get through it all.
And too, I felt like this today. I had got up. I had a rough. So being a parent and a wife today put belt to ass for me. Like I ain't even gonna lie. This whole weekend I've been like on the go doing stuff for my kids, trying to get my house together, combing hair, picking up, dropping out, cooking, clean, everything you could do. I've been doing. But I was saying this to say, like, I was getting phone calls and stuff. I got up, I did my normal routine, which is go to the gym. I was a little late today, but I still made it, got my workout in. So I feel good about that. But I started getting phone calls, and I was just driving, and I'm like, I don't want to talk to no fucking body.
There you go.
And I'm not answering my phone, and I'm not giving an explanation. And when I call you back, don't ask.
Right.
Like I'm responding. But let's start making that a habit to where like we take a day to just don't talk to nobody and just be to yourself, collecting
Do it
your
all.
thoughts, writing stuff down, and just trying to plan like things and asking God to allow you to hear His voice, so that you could do some of the things that you always wanted to do or you don't even know that you want to do, because the world is so noisy and everything is moving so fast to the point like we don't have time to for real collect our thoughts. I'm about to be 40 next month, and I'm literally just trying to learn and figure out who I am as an individual outside of my husband and outside of my
There you
kids,
go.
because I don't know. I've been with my husband for 20 years and I'm about to be 40. That's a long ass time.
It is.
Half of your
That,
life.
A lot of milestones.
Yes. And it's a lot of things I regret, wish I could do differently, but that's gonna be a part of my story. But this chapter that I'm walking in is called me. Like I'm literally gonna love on myself more, pour into myself more, and we have to start doing that. Self-love.
Oh yeah.
When we start loving ourselves, our
Preach.
bodies heal. When we start loving ourselves, people treat us differently, respect us differently.
That's
but it
right.
starts with self. So
Self.
that's just my little take on tonight to just put out there for everybody.
That's good shit. That's good shit. Yeah, I agree.
Yes, indeed.
Well, do you all have other things to add to these health issues and how to deal with them?
Drink a lot of water.
Yeah,
Drink a lot
definitely.
of water. Water helps in numerous ways.
Yes.
Yeah, I agree.
It keeps the hot flashes at a minimum.
Oh, really?
Yeah.
Look,
Let me drink my water tonight. Oh my
That's
God.
my water, but
Oh, it is.
That's yours. You know every
Oh,
time.
there we go. My goodness. Maybe I need two of them.
But I need that water help. That water helps tremendously.
Speaking
Yes,
on
it is.
self-care reminders. Listen to your body. Listen to it. Don't normalize constant pain. Prioritize your mental health. Keep your appointments, ask questions, get second opinions when needed, and most importantly, give yourself grace.
Yes.
Amen.
Amen.
Give yourself
Yes.
grace.
Absolutely.
That was good.
To every woman listening tonight, your pain is real, your feelings are valid, and you deserve to be heard. Don't suffer in silence. Advocate for yourself. Lean on your community. And remember that taking care of yourself isn't selfish, it is motherfucking necessary.
Yes. Yes.
Because if you ain't taking care of yourself, how you gonna take care of everybody else?
Absolutely.
That's facts.
Yes. So, until next time, keep your nails polished, your cocktails flowing, and your conversations meaningful. This nails, cocktails, and combos that we just did was very near and dear to us because we all are suffering with something. Ain't none of us perfect. We just talked about. I said we all perfect. We perfect in some way.
right. Yeah.
But we all dealing with something. But first, we got to take care of our mental, and we got to take care of ourselves, so that we can deal with these health issues that we dealing with. So
That's facts.
that's right. Yeah. This was very informative. I loved it. I loved it.
Yeah,
I loved it. I
And
loved
I
it.
hope this helps somebody out there.
I do
Because
too.
a lot of times, you know, people want to speak up and say stuff, but because like people could be so mean, judgmental, and negative, they keep things to themselves. So this is all raw, unedited, uncut, ain't nothing made of nothing.
None of it.
So if you
Yes.
guys, anybody experiencing, or if any of this information was helpful, I pray and hope that you guys can take some of this information and utilize it, and that it helps.
Yes. Yes,
In more
indeed.
ways than one.
Yeah.
Okay.
Well, until next time. Wait a minute. Before I say next time, next week I'll be at Licorice Lounge between 2 and 7 p.m. next week. Podcasting, and your girl is bartending. So come on, come have a drink.
Yes.
And let's talk some real shit next week.
Okay.
Next Sunday. Next
Look,
Sunday.
I heard we gotta do this one.
Yes.
Clock it.
Not look on this finger.
Oh,
this
okay.
finger, not that one.
Hello,
This
little
one.
horse.
Oh, okay.
Okay.
It's like the little Indian.
Little pony thing.
Yeah, that's what they look like.
Uh-huh.
Indian.
Yeah. So, till next week. See y'all.
See ya.
Oh yeah, we gotta take our
A
shot.
shot.
Kita ain't here, but
Let's swap our hubs.
Okay.
Because hubs got less.
Look,
She's not gonna know unless you guys tell her.
may this wipe out all of our bad flora that
Yes.
come and just causes so
Yes.
much
Oh
havoc.
yes.
Cheers.
cheers. Cheers.
Cheers.
See y'all next week.
Next week, y'all.
Woo! Woo! Ding! Woo!
Hey. Woo. All right, Mo. Love it. Keep it going, girl.
Yes.
Love it.
Yes, this was good.
Yes, that was very informative. I
Love it.
everything
All the
about it.
bloopers and everything.
Yes, yes. Because we got to make funny and not
Yes,
be
be so-
serious about